Hello and welcome to this presentation on the physiotherapy management of endometriosis symptoms. My name is Gillian McCabe. I'm a pelvic health physiotherapist. I work in private practice. I own the company Gillian McCabe Physio Limited, and I'm also the owner of Station House Health and Wellbeing, which is a multi-practitioner centre in the Vale of Glamorgan in South Wales. So I've been working in pelvic health for the last 20 years. I originally trained in the University of the West of England in Bristol. I graduated in 2004, 20 years ago, and went straight into physiotherapy work in South Wales. I started in Newport and then progressed back to Cardiff. So I'm Cardiff born and bred, went to Bristol for university and then made my way back to Cardiff. I've been in Cardiff ever since. I started working quite quickly in the pelvic health field in the University Hospital of Wales in Cardiff, and then managed to get a secure substantive post in pelvic health physiotherapy. It was known as women's health physiotherapy at that time. I started a master's degree in pelvic health from the University of Bradford and completed that in 2015. So I worked within the NHS in Wales for 10 years before I moved on to focus on building my private practice. So around about 2015, 2016, I started to set up a mobile physio practice for women in pregnancy and postnatally, and then established more of a private practice clinic at Infinity Healthcare in Cardiff Gate. After a few years of working there, my practice was getting busier and busier, so I set up in Victoria Park in Canton in Cardiff near the centre and worked there for a few years before finding Station House up in the Vale of Glamorgan. So I started off as a lone worker in private practice. I've gradually built the services and the workforce, and we're now a team of 6 physiotherapists. And also within Station House Health and Wellbeing, we have a number of practitioners registered to rent rooms in our property, and they provide services that help a lot of our patients with endometriosis as well. So the networks and links are really useful. So that's a little bit about me and where I've come from. This is our clinic space in the Vale of Glamorgan, so we're in St Nicholas, just up from Culverhouse Cross, if you do know Cardiff. It's a multi-professional clinic space. There's 5 rooms, so we've got the gym and a therapy room downstairs, and then upstairs we've got a training studio, so a larger room for workshops and exercise classes. It can also be set up as a therapy room as well, and we have a consultation room which is very useful for talking therapies, initial assessments and things like that, and we have another therapy room upstairs. So it's a lovely setting. It's on the main road, it's got free parking, and we have a number of professionals working there. So we've got fitness professionals, therapists, physios, scar therapists, counsellors and psychologists, personal trainers, aestheticians. We've got a wide range of practitioners and services available, so feel free to check out our social media and our website. So our physio company, Gillian McCabe Physio Limited, has 6 fully qualified physiotherapists, and they are each at various stages of their training and expertise. All receive training from myself and other practitioners within this space during their time with us. All the physios are HCPC registered, and most of them are CSP registered also. That's the Chartered Society of Physiotherapy. We all provide assessments and treatments and an evidence-based and empathetic approach, and we all specialise in the management of chronic pelvic pain. We offer assessments and treatments 6 days a week. We're only closed on Sundays. We've got availability in the day and evenings, and self-referrals are absolutely fine. They can book online using our website, or they can contact us by email, however they prefer to contact us. In terms of insurance, if they have got health insurance, it's only available on a cashback or top-up basis, so they need to contact their insurance company. The majority of people are self-funded. So we offer obviously the assessment process. We fully assess head to toe, but including internally with their pelvic floor. And we offer programs of stretching, exercises, massage, self-treatments, treatments in clinic. We can use our scar therapist physio here. We've got fascial manipulation therapy, soft tissue therapy, acupuncture, all sorts of different treatments available at our clinic for those managing or trying to manage endometriosis symptoms. So today we're only going to be covering two main issues. So the problem of endometriosis and the physiotherapy toolbox. And we're just going through the evidence base for the treatments that we offer here in Station House, and also to hopefully provide some inspiration and goals for other clinics or within the NHS that might want to look at developing services within the area of endo management. So the problem or the problems with endometriosis, obviously pain is one of the most common symptoms of endometriosis. So you have pelvic, abdominal, vaginal, rectal pain. Pains can be in various places, and you can get pains directly from the endometriotic lesions, or you can get pain from postural changes, muscular compensations, pulls through into scar tissue and into the nervous system. So we do see pain as one of the most common symptoms of endometriosis. We can also see a lot of myofascial tension, so that's tension in the muscles and the connective tissue. Scar sensitivity and restriction through the scars, and in some cases adhesions in the scars themselves, and that can delve deeper into the organs below also. So sometimes we are looking at visceral manipulation techniques to try and loosen the connective tissue between the organs, and obviously through the muscles as well. We very often see pelvic floor muscle overactivity. We definitely see pelvic floor dysfunction in cases of chronic pelvic pain with endometriosis, but the most common sign that we have is overactivity or hyperactivity within the pelvic floor muscles. That can also lead to core dysfunction and muscle imbalances through the abdomen, through the diaphragm, through the lower back muscles, the hip flexors and the glutes. And that can lead to immobility and stiffness and fear of movement if movement is causing pain and dysfunction. We also see fear avoidance that leads to deconditioning. So if they are fearful of pain with movement, they tend to move less, and it might be moving one joint less, or it might be moving their whole body less and lying down more often, but that can lead to a deconditioning and a weakening of that area. They generally have a poor quality of life when their pain levels are high, and they are often tearful when they come into our clinic. So the physiotherapy toolbox, we're dealing with quite a complex set of symptoms, and quite often by the time they receive physiotherapy, those symptoms have become chronic. So we do get a lot of compensatory strategies, a lot of emotional and psychological changes, and a lot of central sensitization related to the levels of chronic pain. So we have a toolbox, and within that toolbox there are a number of techniques and treatments, self-treatment, education strategies. There's a lot of treatments that we can provide and we can teach patients to use to help them manage their endometriosis symptoms. Within this toolbox, not every tool will be useful for every client. So we tend to go through a thorough assessment, and we start on the tools that we feel from our clinical perspective will be the most effective for that client sat in front of us. So we try and make it as bespoke as possible, and with each follow-up session the patient will come in And we'll get some feedback on how they're doing, whether it's having an impact on their symptoms. And we might have to continue down the same track if it's working, or we may have to change tack and use a different tool or a different way of managing the symptoms. So we tend to review and assess each time that the patient will come in. So the first tool, and probably the most important tool in our toolbox, is lifestyle education. A lot of people with chronic pain will adapt their lives to manage their pain, but quite often the lifestyle adaptations that they make will cause a vicious cycle, and the pain can keep coming through and they can feel lost and misguided in terms of how to live their lives in the management of their pain. So we talk about diet and fluid intake. Obviously, they need to maintain good hydration levels. They need to avoid cutting out important food groups. A lot of people will go onto a diet of exclusion to try and reduce inflammation, but it's important to only do that through nutritional support of a dietitian. We do have dietitians available in Station House, so we tend to forward them on to that if they feel that something that they're eating or drinking is causing an inflammatory response. We do discuss reducing the intake of inflammatory foods and drinks, so things like trans fats, red meat and alcohol, sugary products, but that's not necessarily going to directly link to improvements in their endometriosis symptoms. We try to get them to eat more fruit and vegetables, to have oily fish, olive oil and nuts, but we do tend to defer on to the dietitian if necessary. Vitamin D has been found to improve a number of inflammatory conditions, so we do discuss with them how they're getting their vitamin D into their system. And we do need to think about absorption levels of vitamin D when we're discussing this. So again, we can go through to the dietitian and ask them to help with this. There is also evidence that magnesium can support pain management in endometriosis. So we talk about adding magnesium to their diet, and they can also use Epsom salts in a bath to try and help with muscle relaxation. We discuss the possibility of swapping out caffeine for decaf or caffeine-free alternatives, and we discuss the options of sugary fizzy drinks, changing over to water and squash or herbal teas. For a lot of our patients, when they make the change, however difficult it is at the beginning, if they notice symptom improvements, that change is worth it and they tend to continue with it. So we do ask them the question as to whether they enjoy exercise and whether they move regularly. And especially we ask this, that on their good days, do they get out and move? Do they get out into nature? Do they move their bodies? Do they do exercise classes, or are they very fearful? We want to get to grips with whether they are moving. We also want to know if they are avoiding any certain movements or exercises that might be potentially an aggravate of their pain, because that'll help us with finding out where the mechanism of their pain stimulus is. We make sure that they try to avoid exercise that increases their stress hormones, so cortisol and adrenaline, but especially cortisol, because that can have an inflammatory effect. So they may well be completing exercise regularly, but if the reaction to exercise is negative, we do discuss different forms of exercise that might be useful for them. We do talk to them about listening to their bodies and trying to get rest where possible. Quite often, if they're not active and they're not using up energy through the day, then they don't feel like sleeping and they can lose that circadian rhythm that improves their rest and their sleep. So we do discuss with them ways of improving that circadian rhythm and getting routine into their daily lives. And exercise is a big impact on this. What they drink and when they drink, what they eat and when they eat can really help with improving their circadian rhythm as well. We talk to them about phone usage, especially at bedtime, and trying to reduce stimulus at bedtime, try to have routines that will encourage sleep so that they do get the rest that they need for healing and recovery. We do discuss with them their stress levels. So it might be home stress, work stress, stress relating to their condition. And if we feel that it is having a negative effect on their symptoms and their progress, we may well refer to one of our counsellors or psychologists to help them. We can use the hospital anxiety and depression score to help with this if they're not so able to articulate how they're feeling. It's really important that we talk to these individuals for pain education. Pain education in the past has always related pain to injury or a problem in the area where the pain is felt, but more current research has found that pain is produced by the brain and is often a response to threat and is not always a sign of damage. It's really important that our clients understand how pain works within their brain and their body. So teaching them that their brain can increase or reduce pain levels in response to various factors, such as their previous experiences, how they're feeling, environmental cues, could be sights or smells, or it could be walking down the hospital corridor, it could be getting in and out of the car, they've had pain previously. There could be lots and lots of different factors that will increase their pain. And pain increase doesn't necessarily mean that they're doing something that is causing damage. So it's really important that they know that. Chronic pain often involves what's called central sensitization, where the nervous system becomes more sensitive to pain signals. And in more severe cases, a small stimuli like a stroke on the abdomen can elicit a strong response. So that could be a protective spasm within the abdominal wall with the feeling of any sort of slight touch to the abdomen. And that can be a protective response from the central nervous system as opposed to pain and damage within the abdomen itself. Repeated pain signals can strengthen pain pathways. So we're talking neuroplasticity here. So the more they receive those pain signals, the stronger those pain pathways and the harder it is to switch pain off. So we need to work on ways of reducing those pain pathways. So we have tools that can help with that. The other issue is that stress, fear, anxiety, depression, and catastrophizing can amplify the experience of pain. And it's really important that we spend time with our clients to discuss the effects of stress, fear, anxiety, depression, and catastrophizing and try and coach them through this. And quite often we do look into psychology support, counselling support to help our clients manage the day-to-day effects on their central nervous system from the pain. Here's some really useful links and organisations and books that you can go to. So we have in the UK the Pelvic Pain Network, set up by my colleague Gilly Bond and her colleague Virginia Rivers Bulkley. It's definitely worthwhile going to see their website to see what they offer and the resources they have available. There's also the Noy Group and Professor Lorimer Mosley. He's got lots of videos online about pain science education. There's People in Pain Group, so pipain.com. There's books by Lorimer Mosley and David Butler and Adrienne Liu. And there's the organisation, the International Association for the Study of Pain. I would definitely recommend looking into those. So moving on to another tool in our toolbox, we are getting hands-on now, and manual therapy. So we can provide manual therapy to various areas of the body. The most common area that we would use manual therapy on is pelvic floor. And the pelvic floor is very often overactive, it's gripping, it's tight, it's pressured. That can lead to problems with pain sensations within the pelvis, neural impingements, reduced circulation, dryness within the vagina, irritation, inflammation, and that can include inflammation around the bowel and around the urethra and the bladder, and generally, if the pelvic floor is overactive and unable to release, that becomes a vicious cycle. So we quite often use internal vaginal techniques to gently help release those pelvic floor muscles. We can also use visceral manipulation. So this is gentle manipulation of the abdomen especially to improve mobility and function of the internal organs, and that can help with tensions and adhesions that can lead to pain and dysfunction with posture and muscle balances. We will quite often, for visceral manipulation and especially adhesions or scar tissue issues, we will defer over to Libby Williams, who works in Station House as a fascial manipulation specialist and scar therapist. And she really helps a lot of our endo clients. We also work on myofascial release, so that's the muscles and the connective tissue. You might have heard of soft tissue massage or sports massage. They're all similar techniques. And we're looking at releasing off areas of tension and restriction so that we can then enable that client to move more freely, to improve their posture and to improve the space available within their abdominal pelvic region. The multidisciplinary approach is really important. We tend to use a lot of our therapists here within Station House, and it's important to have access to therapists such as nutrition and dietetics, other physiotherapists, scar therapy, counselling and psychology, personal training, massage therapy, acupuncture. All of those sorts of multidisciplinary approaches will provide a greater relief for a greater number of clients, rather than trying to use one treatment method which will work for a certain proportion of the population but not every. So you need to have some level of ability to change the approach according to what that individual client needs. We also use electromyographic biofeedback and electrical stimulation. So we have access to the Novacare Maple from the Netherlands, and that helps with pelvic floor pain management. So we can use electrical stimulation to reduce overactivity within muscles, reduce nerve activity, improve pain signals or reduce pain signals. And we can also use the biofeedback to retrain muscles. So retrain muscles that are weak to strengthen them, and retrain overactive muscles to loosen them off and release them. The Maple is unique in its function. It has 24 gold electrodes along its finger-sized probe. Each electrode will sit on a specific muscle within the pelvic floor. So we can be specific to find out the electrical activity within each muscle of the pelvic floor, from superficial to deep, from right to left, from front to back. We can get information on our iPad as to what is overactive and what is underactive, what is restricted and what is free. We can then apply treatments, whether it's biofeedback or stimulation, specifically to those affected muscles. And we can also apply treatments for pain management and reducing nerve pain signals within the pelvis to specific areas where that pelvic nerve will follow. So we use Maple very regularly with our endometriosis clients. We definitely look at our clients' posture and their movement strategies, muscle balances. We try to aim for a canister of their core where the thorax and rib cage are aligned with their pelvis. This helps all the muscles and the ligaments and the connective tissue to work more efficiently, and it helps to reduce stress and strain at certain points within the spine and within the abdomen and within the pelvis. So good posture will help all those joints and muscles to function within their normal ranges. So it gives the body the best chance of reducing pain. If you have good posture, then you've got less likely to have an issue with muscle imbalances. And muscle imbalances we see so regularly, with maybe the right side being tighter than the left or vice versa, or the abdomen being a lot weaker than the back, or the glutes being switched off. We see a lot of postural and ergonomic issues with muscle imbalances. Now, this could be related to their pain, It could be related to regular postures that they adopt in their workplace or at home. Maybe, for instance, they are a mother who lifts and carries onto one hip more than the other, or it could be someone who sits on the sofa and curls their feet up underneath them in the same direction every single time they do it. So we do tend to see these imbalances coming from things that they do day to day, repetitive tasks or repetitive positions and postures. But we also see it the other way, where the pain is causing those muscle imbalances. So they move their bodies in abnormal ways to reduce the risk of pain and dysfunction. So here we have the core connections. So with your core, you have the diaphragm at the top. It's actually the glottis at the top in your throat. So the glottis is part of your voice box. And when the glottis is closed, it can change the pressure within your core canister. But for this purpose, we are looking at the diaphragm as the top of the core. The diaphragm is your main breathing muscle, and it's often restricted in pain conditions. So if the diaphragm is restricted, quite often the pelvic floor then will be restricted. They do tend to mirror each other. So as the diaphragm causes exhale and pushes up into the chest cavity, the pelvic floor is more likely to tighten and lift. And when the diaphragm pulls and flattens, causing inhale, then the pelvic floor is more likely to release. But in cases of pain and chronic pain and restriction and postural changes, we do quite often see both the diaphragm and the pelvic floor in an overactive state. So they might be overactive and pulling, or overactive and pushing, and that can cause an increase in pressure within the core canister, and that can lead to increased pain. So breath work is essential to managing pelvic floor overactivity and essential to managing pain in general throughout that core region. So we do a lot of breath work, we do a lot of diaphragmatic release, a lot of rib cage movements, a lot of stretching with breathing to try and improve the movement and the mobility of the diaphragm, the rib cage, the intercostal muscles, and the muscles that attach between the rib cage and the spine at the back of the thorax. The pelvic floor, there's 2 layers of muscles. There's 12 muscles altogether, 6 in the superficial layer and 6 in the deep layer. Any overactivity or tightness can restrict the space within the pelvis. And we know that endometriosis is space occupying, especially at certain points in the cycle where the tissue becomes inflamed and can take up more space. Restriction can be caused with bladder and bowel function as well. So sometimes if the client is constipated, the bowel is more likely to take up space. And if the bowel takes up more space and the pelvic floor is tight and the endometriosis is flared and inflamed, they are more likely to have a severe aggravation of their pain. Moving over to the right-hand side there, the rib cage and the thorax. So we have potentially poor posture, those imbalances that we talked about in the last slide, restriction within the rib cage, poor expansion within the rib cage can lead to an increase in pressure. It can also lead to pain and fear. And the fear and anxiety can increase because of a lack of respiration. So people who take shallower, quicker breaths are more likely to be of an anxious state than those who are taking long, slow, deep breaths. So we definitely do a lot of breath work to help with the rib cage and the thorax. We work very closely in connecting with the deep abdominal muscles. Quite often in clients with pelvic pain, with endometriosis, the upper abdominal wall tends to be active and tight and restricted, whereas the lower abdomen can quite often be loose and disconnected. So we try and restore the balance. The back of that deep abdomen involves hip flexors and back muscles that help to combine with the abdomen to improve pelvic pressures. So we do look at releasing those off, specifically quadratus lumborum and the psoas muscle, which can, when they're tight, can cause restrictions at the back of the abdomen. So the breath work there, so if you have good breath work, you can activate your parasympathetic nervous system and promote relaxation. The breath work can shift attention from pain and reduce pain sensations, and good breath work can help to regulate emotions and manage stress. So we do a lot of work on improving the breathing of our clients. We might use massage techniques. We might teach them to massage their diaphragm and their upper abdomen. We might give them stretches and mobility work to help improve their thoracic mobility and improve their breath work as they do that. They generally start in clinic with us, and then as the upper abdomen starts to release and the diaphragm starts to work a bit better, we can give them strategies to use as homework, which they use week by week until they come and see us again. We use exercise therapy. So that's not necessarily just going for a walk. We need the exercise therapy to be specific for what they need. We generally use our assessment strategies, and we work with our fitness specialists and massage therapists to help release off tension and work on ways of strengthening the weaker or disconnected muscles. So exercise therapy in and of itself, in general, will help to reduce systemic inflammation. And regular exercise reduces the levels of pro-inflammatory cytokines. So general inflammation will reduce if that client is able to exercise on a regular basis. So we have to keep remembering that. Exercise will also obviously improve circulation and improve tissue oxygenation. It will also help to get rid of toxins that are building up within tissues. Regular exercise stimulates the release of endorphins, which are our natural painkillers. And regular exercise will also help to regulate estrogen levels. So it's important to find an exercise that the client can do that doesn't aggravate pain, that gives them the confidence to move and also gives them these important benefits. There are different types of exercise. So we've got walking, swimming, cycling. They'll all improve cardiovascular health and reduce pain. Yoga improves flexibility and reduces muscle tension, and it also improves the connection between the brain and the body. And then strength training improves muscle tone, which is support of joints, reduces muscle imbalances, and supports the pelvis. It's got to be an exercise that is individualized for that person. If the exercise causes a stress response, then you're only going to increase inflammation. But that's not to say that that client can never do that exercise again, but it might mean that they have to progress to that exercise in future and find something that is less stressful now that they can work on and build their cardiovascular health, build their strength, build their flexibility and mobility until they are able to progress on to that exercise that they would really like to do. And we, along with the fitness professionals, can help them with that process. There is growing evidence for the use of acupuncture for pain management in endometriosis. And the findings so far show that acupuncture increases the release of endorphins and enkephalins for improved pain modulation. They can also reduce the levels of pro-inflammatory cytokines, so that can have an anti-inflammatory effect. Acupuncture also activates the descending inhibitory pain pathways, therefore reducing those pain pathways. And acupuncture has been found to be particularly effective in reducing dysmenorrhea in people with endometriosis. Acupuncture has been found to improve fatigue levels and emotional well-being over 12 weekly sessions. And there's also evidence that acupuncture from a pelvic health specialist can alleviate urinary urgency and bowel discomfort. So it's worth looking into acupuncture as an option for treatment for those with endometriosis. So we've talked a lot about linking in with other professionals, and for mindfulness and stress management, we definitely use counsellors and psychologists to help with this. We've got to be careful in physiotherapy that we don't go outside of our scope, so that's why we've set up this clinic here in Station House, so that we have places where our patients can go. Chronic stress can exacerbate pain perception, and endometriosis symptoms in and of itself, the fact that that client has that condition, can be a stressor in and of itself. So we know that stress leads to increased levels of cortisol and other stress hormones. Stress can lead to a mind-body disconnect. So we see that a lot in stress and anxiety. They can dissociate from their body, and they can dissociate from the area that causes the pain most often. So in physiotherapy, quite often we will work on the mind-body connection with physical touch, with movement, with stretching, with exercise, all in a mindful approach. There is evidence that mindfulness-based stress reduction, so a specific program, MBSR, has been found to improve pain perception, coping mechanisms, the reduction of emotional toll of chronic nature of endo, and an increased sense of acceptance. So it helps with emotional regulation and improved responses to pain triggers. So that doesn't necessarily mean that it stops the flare and the aggravation of symptoms or the inflammatory response, but it can improve that client's ability to cope and that client's ability to manage their emotional response to a flare-up. Cognitive behavioural therapy, also known as CBT, has led to a significant reduction in pain intensity. So that addresses negative thought patterns and improves coping strategies. So CBT is specifically useful in reducing stress-induced pain flare-ups. And yoga with mindfulness is a really useful tool. Quite often what we would suggest is that they would see a counsellor or a psychologist first to get these strategies in place, and then add in yoga once they know how to apply that to their session. So that's the toolbox. So our services are available in South Wales in private practice. So this is not NHS services, but there are NHS physiotherapists in pelvic health who you are more than welcome to contact and discuss these toolboxes with. These are most of our physios. We've got an extra one now. We have CC on board now as well. But we have myself in the middle, and then to the left, Shakira and Rhiannon, and to the right, Catherine and Lucy. And we are all pelvic health physiotherapists. You can find out more about us at the website gillianmccabe.co.uk. So we are all helping with assessments and treatments for endometriosis related symptoms, as well as other problems like bladder incontinence, bladder pain, stress incontinence, urgency, constipation, bowel incontinence, vaginal prolapse, all sorts of different issues relating to pelvic health. But within our field of expertise is endometriosis management. I also run Pelvic Academy, which is a training program and network for physiotherapists who are interested in getting into pelvic health. So that's led by me. We do regular training days, and we have online support and support via a WhatsApp group. Then we've got the multi-professional network in Cardiff and Vale area to assist women in symptom management and improvement in quality of life. So that's through Pelvic Academy. So wherever your clients live, they can probably access a physiotherapist with a short drive to get their symptom management through that toolbox. So the NICE guidelines don't actually currently specifically mention physiotherapy management of endometriosis symptoms. So there is a need for more evidence and more research, but we are hoping that that will increase over time, and we will find our services found in the NICE guidelines in the future. I also offer for patients online training. We have 3 courses available. Foundations, which is all about learning about the core and how the core works, a little bit about some of the slides previously. We have a breathe course, which helps people to improve their breath work, to improve their ribcage mobility and diaphragm mobility, and to connect their breathing down into the rest of their core. And then we also have Reconnect Pelvic Floor, which is about reconnecting with the pelvic floor, and also a 6-week program on improving pelvic floor function, strengthening weakness and releasing off tension. So that's available via the same website. You just click onto online courses from the homepage. So in 2025, we're hoping to start this in January 2025. We are going to start a programme for those in South Wales and anyone else who wants to travel in, called Endo Empower. It's a programme that is a holistic path to pain-free living. We will be offering a 1.5 hour free in-person educational talk, and that will include refreshments and a support network. You will be able to add the patient into a WhatsApp group where they can ask questions and find their answers from a physiotherapist who is working in an evidence-based and empathetic way. A lot of the online support networks through social media can have quite a negative impact on many clients. So we're trying to keep it more of a positive and progressive, evidence-based network where people can feel like they can make progress in their symptom management. We'll also be providing online resources. So we'll be providing resources on education about endometriosis and the physiotherapy toolbox. We'll be offering information on pain science education. We'll be offering information on lifestyle modification and advice on how to change their lifestyles to help improve their symptoms. We'll give access to a symptom tracker, and Endometriosis has got a really good symptom tracker on their website, so we'll be linking in with Endometriosis and endo.org. And we'll also be providing posture and ergonomics advice online. So that's all free. And then there's optional add-ons from the programme, which would be a full body physio assessment and screening for those with suspected or confirmed diagnoses of endometriosis. That would take 1.5 hours with 1 or 2 physios present. Pelvic floor manual therapy sessions to help with release and relaxation. Abdominal and diaphragmatic massage sessions, either with a physiotherapist or with a fascial manipulation specialist or a myofascial release specialist. Scar therapy sessions if needed. Maple therapy, which is usually a 6 to 8 week program. One-to-one female-specific personal training for those with endometriosis who want to get stronger and exercise more and feel more confident with movement. Reformer Pilates classes. Now this will be at a different location to Station House, and that will be via Core Cardiff with one of the physios here, Shakira, who set up Core Cardiff in Lakeside near Roath Park, and then acupuncture sessions if needed. So all of those optional add-ons will include extra fees, but the initial group work and resources will be free of charge. We are hoping to bring in some group sessions for movement, for breath work, for all of those things that we've talked about from the slides previously that are possible to fit into a group session, but we'll keep you posted on that. So thank you so much for listening to this presentation. If you do have any questions, you can contact me. I'm available on WhatsApp on that mobile number, so you can find me there. You can email me info@gillianmccabe.co.uk, and you can find out more about what we offer for the physios at Gillian McCabe Physio Limited at gillianmccabe.co.uk. Feel free to ask me any questions that you have, and if you would like to come and spend some time with us in clinic, we do have slots available now and then depending on how busy our clinics are. And if you do have a client or a patient that you would like to follow through and see what we do in physio with that individual, you are more than welcome to get them to book an appointment with us and come along as long as they give consent, and we can go through the process with you both present. So I really hope that you found this useful, and I'm looking forward to hearing any questions that you have. But all the best with your management from your side with the endometriosis patients that you see. We are more than happy to help you if needed. Thank you.